Personnel Committee meeting. I am joining by audio only because I just want to make sure everybody knows they should use their sunscreen. On Friday, I had a little procedure, and seriously, sunscreen is important no matter what your skin color is. So I'll just say I'll be using audio for a little while.
Martha, do you still have a nose?
That's kind of actually not funny.
I'm sorry.
No, yes, I have a nose.
Well, good. We're glad.
Yes. Okay. Now I'm thinking of Joe Mariana. So Kathy or anyone else, are there any changes to the agenda? I don't have anything. Except, okay, Kathy, except to say that I will ask for an executive session at the end of this meeting to discuss a personnel issue regarding one particular person. All right, do we have any comments from the public, Kathy? I don't have anything.
No, I did not receive anything.
Okay, thank you very much. Then if it's all right, let's dive right into the resolutions. We've got Resolution A, and I hope on the airport, and I hope folks had a chance to see the revision that we sent out sort of midday. And if I could get somebody to put this on the floor, Resolution 9341. Dave McKenna, I want to go ahead. Dave moves.
Yeah, I move.
And Shauna seconds, authorization to transfer funds from the airport fund balance to the airport operating budget for professional services, customs facility costs, Ithaca Tompkins Regional International Airport. So Mike Hall, welcome.
Thank you, Martha.
Give us some background on this.
Well, as we've had a couple of parts involved in rolling up customs. One was to finish the facility, and the other is to put people in the facility and equipment in the facility and get it operating. The first goal was achieved in December. It was not clear, it still is not entirely clear when the second goal will be achieved. We got one piece of equipment that's probably not going to get here until July. And then we have to get an officer assigned into the facility and in. So what we did was we decided that the 1st of July was the earliest that this facility could become operational. And we chose to ask to seed the amount of money that it would take to reimburse customs for their officer for half of 1 year. That's the number that's there. That's a not to exceed number, but we won't be open on the 1st of July almost for sure. So, you know, the estimates right now range from 1 July to 1 October. Now, 1 October is later than everything else should be done, but it's also the start of a federal fiscal year. So, you know, when you think about it, that may be what customs comes back with. So, so this is kind of a line of credit against getting the facility operating. And we don't expect to use this amount of money in 2020.
Thank you very much. Discussion or questions in the committee? Shauna?
Yeah, I just wanted to make sure that this is a pass-through and that this is actually money that was provided by either the feds or the state.
No, it's not a pass-through. This is a fee facility. We will be managing it within the airport budget, but it has to start somewhere, and you can't collect money ahead of time. So we're borrowing from the airport fund balance in order to get started, and then we'll begin the operation of the facility. And within the broader context of the airport budget, it'll be carried within the airport budget going forward. But we have to start somewhere, and this is where we have to start.
And how much is the airport budget or the airport fund balance right now?
Well, there's 1.7 million of CARES money plus 1.3 in the airport savings account, if you will. So something near $3 million that's available. We want to use the 1.7 to the greatest degree we can to reduce debt, but we don't really have a clear picture yet of the end game, of the impact of the pandemic on air travel, when it's going to come back, how much is going to come back, et cetera, et cetera. So the strategy here is to make decisions when they need to be made, not make them earlier than they need to be made, because with each day, as you're well aware, we have more information. Two days ago, we didn't know that Delta was permanently pulling out of Wilkes-Barre, Pennsylvania, but they are. So this is the kind of life we're living right now.
Okay, thank you.
Other questions or discussion? Mike, I was wondering, who hires this person?
CBP hires them. It's a CBP officer, no different from any other CBP officer in the sense that they're federal civil service and they're assigned here, but we are required to compensate them for the FTE, is the easiest way of saying it. Much like some of the expenses that we pay TSA, so that it's not an unprecedented idea for the federal government to provide a service and the user to have to contribute to supporting that service.
Okay.
And this is no change. This has been the way it's been, since this whole thing was conceived several years ago.
Okay, Deborah?
Yes, I'm just curious. We only reimburse CBP for the time the employee works here. We're not on the hook for retirement and health insurance after retirement and all that other stuff.
No,
right?
We are renting a CBP officer, I guess is the right way of saying it. So,
Thank you for that clarification, Mike.
yep.
Sorry.
Okay. Shauna?
I'm sorry. I have one more question. I'm just wondering, the way that air travel is right now, and we want our airport to be successful, but what if we don't have the traffic that we thought that we would a year ago, and we're spending $70,000 on having someone staged in this location? At what point would we say that this isn't working out and we're bleeding cash?
Well, first of all, we have a 120-day severance window on the agreement with CBP. Second of all, I've got a conference call tomorrow because it's been my interest in providing the services of this officer to Corning Incorporated at the Elmira Airport on a fee-for-service basis, another pass-through, if you will, which would reduce our cost. That's way too early to talk about that, but it would make too much sense for our customs facility to be the southern tier hub, if you will, and for us to be able to provide service to other airports, reducing our expense. Right now, that's not allowable within federal policy, but it's federal policy. There's nothing written in the law about it. It's just their latest policy. So you can expect to see over the next number of months some initiative and some report back if we can move the ball closer to the idea that we would be the regional CBP rather than just the CBP for Ithaca, which is what's required now.
Okay.
Yeah. And general aviation, by the way, is coming back strong. Those people who can afford it, business travel in particular, would much rather be in an airplane with people they know than in an airplane with people they don't know. So our general aviation count is back pretty much to normal at this point. Now, in terms of the airport overall, American's adding another flight in July. Had a long discussion with them a couple days ago about Charlotte and Chicago, they're trying. They don't have as many airplanes available as they had before. They parked a bunch of jets. They're retiring the 50-seaters early, all that sort of stuff. So it's not as simple as saying, well, yeah, we served you a few months ago and we've got plenty of airplanes sitting around so we can pop you back out. So American's looking good. Delta just converted us to being Delta from being contract. So that's a positive sign relative to their interest in us in the future, as opposed, for example, to Wilkes-Barre, where they announced this week that they're closing permanently, not temporarily. And then I think you know that United has, I guess, we don't have any direct word from the government about this, but the word to the station manager in Ithaca from United is that they were going to suspend service through September, but their schedule is still loaded. And we know that Senator Schumer wrote the president of United, and you know, for all we know, that correspondence didn't make it back down to the people, you know, the left hand, right hand kind of thing. So you're right. There's a great deal of uncertainty, and there are no answers. No amount of diligence will get you answers today because they change on a daily basis. But we are spending an awful lot of time working on that relationship, trying to get the airport service back to where it was and beyond. We were up 20% in January and 20% in February this year. And we think that the economy and the success of Cornell and Ithaca College and local industry depends on having a connection from this county to wherever you need to go. So we're working our way back. But most of the projections from the airlines say, 18 months for a full recovery, whatever that means. They're just too many, it's all speculation, and we could talk for hours about what might happen, but only with the passage of some time will we know what's actually going to happen. We're just trying to present ourselves in the most favorable position relative to being, look, if you're trying to choose between two communities to resume service, choose us. And a lot of that depends on what's announced later this month by Cornell. We already know where Ithaca College is coming from, Cortland, Wells. So.
All right. So.
Never a dull moment.
Yeah, of course we don't have hours. So let me, Annie, is your hand up? Ann Corman? And then go to Deborah. Annie?
Yes. Can you hear me?
You're really wobbly.
Can you hear me? My internet is really bad.
Okay, go ahead.
Slow. Mike, I was wondering if part of the money that this position will help bring in is not just from passengers, but from cargo.
No, the money that the airport is able to raise against the cost of this position comes from a number of sources. Most directly, it comes from inspecting people and cargo. And, a few months ago, we had and will have again, I believe, an interest in a foreign trade zone, which could be part of the employment of this individual, working the passage of hard goods in and out of a warehouse. Then there's also increased traffic, fuel sales at the airport as a result of this service. So there are some direct compensations, and then there are some indirect compensations that relate to having this capability at the airport.
Okay, Deborah?
No, I was just about United, and Mike already covered it.
Okay. Any other discussion on the, we all very interesting. We'd love to hear more and spend more time on the airline service altogether. It's a big concern, but anything else on this particular resolution? And just to confirm, everybody got the revised one that was emailed today. I'm seeing some nods. Let's assume that's a yes. Okay, then I will take a vote across the screen as I see it. Deborah Dawson?
Yes.
Sean Black?
Yes.
Dave McKenna?
Yes.
Mike Lane?
Yes.
And I'm a yes, so that is anonymous. That's unanimous. Okay, appreciate your time, Mike. Thank you so very much.
Well, thank you, and thanks for helping us clarify this a little bit. It's a different kind of a situation.
Sure, no, happy to do that. Second resolution, creation of position, election worker, Board of Elections. Could I get somebody to put that on the floor? I see Deborah puts it on, moves it, Shauna seconds. All right, hello, Elizabeth.
Hello.
Steve is here, but so do you want to give us a thumbnail on this one?
Sure. So Essentially, we have election inspectors that most of the time only make $600 a year.
Mhm.
However, we're now using them for early voting also. So to be official, we need to have an actual title and make them an actual employee of the Board of Elections.
Okay, sounds pretty straightforward. Any questions or discussion? Ready to vote. All right, Deborah Dawson. Oh, I'm sorry, Mike Lane. Sorry, I didn't see you.
By making these employees, Elizabeth, are they entitled to any fringe benefits aside from salary?
No, they're only, this is a category where they only make up to $1,800 a year.
Okay, but so that doesn't put them into any of our benefits.
Exactly. Yeah, we work closely with Greg and Lisa on this proposal.
Thank you.
Except that there's a line of $900 on here as fringes.
I believe we have to budget fringes anyway, even though they don't receive fringes, because I have other positions in the office that are similar, but it has something to do on the finance side.
Jason?
Social Security has to be paid, and probably also retirement credit.
Okay, sounds good. Okay, Mike, is that covered?
Yes, thanks.
All right, thank you. Ready to vote? Deborah Dawson,
Yes.
Dave McKenna,
Yes.
Shauna Black,
Yes.
Mike Lane,
Yes.
and I am a yes. So thank you very much, Elizabeth, and thanks
Thank you.
and good luck with all your adventures over there.
Thank you so much. We're getting another 3 tubs in tomorrow of
Wow.
absentee ads.
All right, well, good luck. All right,
Thanks.
we now have resolution to put on the floor on retirement. And if I can, should we start by putting that on the floor? The resolution that was emailed to us Friday and again today. Let's start with that. Deborah moves it, seconded by Dave McKenna. All right, Jason, you want to take it away? Or Lisa or Sarah?
Yeah.
Or
I was just adjusting my my screen. Sorry.
okay.
Thank you for that. So we sent out a complex set of documents, a memo that really I have to commend Lisa and Sarah for doing a very, very thorough job over the course of the past, I want to say 3 or 4 weeks intensively, to try to understand the dynamics of the county's current retiree healthcare circumstances. So I think the first thing that we should acknowledge is that we're dealing with, it's a very sensitive issue. It's health insurance. It's important to everyone. So it's difficult at times to discuss because it's very personal to everyone. That's both existing retirees and folks to become retirees. So we recognize that. The county is not changing its commitment with these proposals. We're not changing the county's commitment to providing a comprehensive health coverage for its retirees. We are essentially, after we reviewed it, and we've started to review this last fall, what we realized was that there were some really significant shortcomings that were costing both retirees as well as the county a significant amount of money to continue with that comprehensive coverage. So as we were looking at this last fall, we were expecting to bring something forward this year. And just so happens to be on a timeline that will now corresponds with a retirement instead of considering the current financial circumstances. That said, every retiree and employee's circumstances are different when they decide to retire or where they are in their retirement, whether it's age, whether it's their family circumstances, whether it's their health situation. So to be able to provide this that covers every single employer retiree or that addresses every single issue is virtually impossible. That's both an active employee circumstance or a retiree circumstance. What we did was try to continue to provide, I think we achieved that very successfully in most instances, comprehensive coverage to continue for our retirees, as well as providing continued comprehensive coverage for existing employees as they contemplate retirement, whether it's now or whether it's in the future. It's also a practical and sustainable approach to moving forward, where there are definitely elements of the current circumstances which we don't think are sustainable. We can definitely talk about that in more in depth. Much of the proposals surrounding existing employees are expected to take place at different times versus the retirement incentive and when a turnover for new benefits are for future retirees. So we'll talk about the time frame as to when things would move forward, because there are several different time frames, if you notice, within those proposals, and those are for specific reasons. And I guess one last thing, and then I'll let Lisa kind of go through the presentation and suggest we answer questions after that, because there's a lot of detail here, is that these proposals do not apply to the Sheriff's Association, the patrol members, because patrol is the only unit that has it in their collective bargaining agreement. And these are changing benefits both currently and moving forward. If they want to consider this, and I did call the union president on Friday to make him aware it was being released, we can definitely entertain this at the negotiating table with the union, but these proposals would not apply to the sheriff's deputies. Also, Tompkins County Public Library employees, which are not our employees, they're employees of the library, while they have in the past followed ours, it's a decision that the Board of Trustees has to make if they want to follow this particular benefit pattern. I guess just that's something I want to just outline for that. In that sense, again, we have actually one edit and one addition to the resolution that we'll go over as we get through. There was an error on our part in one place, and then an addition that has come up after the fact, after we've spoken to a few folks, that we think is a good addition with respect to reviewing the cost of the Medicare supplement 2 years after implementation. And this is a discussion more so not about the share that we have with retirees, but more so how the consortium determines and negotiates its benefit with Excelis based on premiums versus claims. And it's a good addition, and we'll talk about that as well. So I'm going to turn it over to Lisa to kind of go through the presentation. We tried to simplify it as much as possible, but as you can see, it's definitely complicated. But we'll get into it now. And Lisa, I'll turn it over to you.
Okay, great. I'm going to try to share my screen with everyone and go through a PowerPoint presentation. Let's see. Here we go. It says I'm screen sharing. Can folks see it? Okay, great.
Yes.
Great. So I'm going to do this then. It's 10 slides covering the healthcare topic. And just see. All right. Now there are 9 slides to. Okay. So as you received in the memo, we currently have a pretty much a complex matrix of cost sharing methodologies to calculate retiree health insurance. And the first area where we're going to propose some changes is really just kind of more or less a housekeeping or simplifying the current cost sharing rates for retirees under the age of 65. And that's really because right now the individual and family platinum plans are pegged to the cost of the classic blue plans, which makes it complex in and of itself. But also, as we're seeing, as more and more people are getting off the classic blue plan, those rates are becoming more distorted. And, you know, at some point, people may be off of those plans entirely, and we would just prefer to make these based on percentages instead of pegging them to any one individual plan. It just seems to make sense going forward. So this slide just indicates where we are right now, how these rates are calculated. And the next slide is where we'd like to go with it. So on the left side here, the current cost sharing rates for retirees under the age of 65, we looked at the last 3 years of the actual rates, how they panned out, and they were consistent across those 3 years. And they are as follows in the chart. And what we're proposing is kind of to round those rates and simplify it, streamline it moving forward for this cohort of employees that are under the age of 65. And wherever possible here, we rounded toward to make it in favorable to the employees, slightly favorable to the retirees. So these are the rates that we are recommending moving forward. And what this does, it standardizes the rates for all of the plans. It takes away the benchmarking onto the classic blue plans. It makes it easier to understand to the users, and it makes it easier for us to administer. It results in slight savings to the retirees, and it results in a slight additional cost to the county. But I think that's kind of probably made up for in terms of staff time and ease in administering the plans. And we're suggesting that this be effective starting January 1st until this subset of the retirees becomes Medicare eligible. They would just be at these rates for that time period. So that outlines the first proposal, really just
Just to clarify, Lisa, on that last slide, if you go back real quick, the orange column, the yellow column there, that is the equivalent percentage. Obviously, when it's calculated, you have to go back to the prior slide and read the somewhat convoluted way that it's determined. The equivalence, just to show apples to apples, is why we created this next slide to show you here is the percentage equivalent on the left-hand side, and the right-hand side is where we want to go to clean it up. So it's an easy, straight percentage calculation, not a percentage calculation minus another percentage calculation, added and subtracted and square rooted and everything else that it does to calculate it.
Thank you. Yeah, that's a good summary. Thank you. So the second proposal is looking at our Medicare eligible retirees. And as we outlined a bit in the memo, when a retiree turns age 65, Medicare becomes the primary payer, and the employer-based coverage is the secondary payer. And really at that point, it is in the best interest of a Medicare eligible individual to cover the medical costs that Medicare doesn't cover through gap coverage, or a Medicare supplement plan, is otherwise known as a Medigap plan. And through the, so what we have been offering to date has been another full insurance plan, either Classic Blue, PPO, or Platinum plan, which essentially duplicates what Medicare is already covering. So we're, in a sense, over-insuring the over 65 group of employees. And a Medicare supplement plan really provides that gap coverage that Medicare doesn't provide. It also provides prescription coverage. And it's more affordable than the cost of another full plan. So through the healthcare consortium, there are 2 Medicare supplement plans offered. And of those, the Medicare Supplement 4 plan, or MS4 plan, provides very comprehensive coverage at the least cost. So we currently have 194 county retirees and 46 spouses, where one individual in the household is Medicare eligible. They're currently enrolled in the assortment of these full plans, Classic, Blue, PPO, and Platinum. And this proposal recommends that all of those Medicare eligible retirees enroll in the MS4 plans. I should mention that all of the Medicare supplement MS4 plans are individual plans. There are no family plans. So for a two-person household, if both individuals are on Medicare, they would each get an individual MS4 plan. If one person in the household is not Medicare eligible, they would have an individual platinum plan, and the spouse or the retiree would have the individual MS4 plan. And even the cost of both the individual platinum plus MS4 or two MS4 plans is less expensive than the cost of one family plan. So under this proposal, about 2/3, 126 retirees would stand to save anywhere between $50 and $500 per month, or about $600 to $6,200 annually, with no decrease in coverage. At the same time, we have about 1/3 or 68 of our retirees who are currently on an individual platinum plan, which is heavily subsidized currently. They are currently paying $25 a month for individual platinum, and they would pay an additional $263 per month, or about $3,100 annually. So they would be paying more. However, in that change, there are not co-insurance payments under MS4 plans. So there would be some average annual savings of about $480 in co-insurance payments on the MS4 plan. Making this change would potentially save the county about $920,000 annually. And we would propose that this become effective January 1st of 2020. We also stated in the memo, we would be doing a very robust education and reaching out to current retirees to make them aware of the changes, the coverage, et cetera. So this outlines what, again, where we're at and where we're going with proposal 2. So again, on the left side, the orange chart shows the current cost sharing for Medicare eligible retirees. And on the right side in the blue, the proposed cost sharing. So on the left side, you'll see that the individual Classic, Blue, and PPO plans, those would no longer be available on the right side of the equation. Everyone would be going to the Medicare supplement at a 50-50 cost share, both retirees and the spouse. For the individual platinum plan, the county retirees under the age of 65, we're saying would go to the 25-75% split. That's consistent with our previous slides showing our under 65 rates for current retirees until they become Medicare eligible. Then they would go to MS4 at the 50-50 split. And for spouses, the split would be 50-50, and family platinum would be offered at the 50-50 cost share.
Okay, Liz, before you go to proposal 3, if you don't mind, I'm going to admit there's only so much I can hold in my head. So if we can go to questions and comments, especially questions on proposals 1 and 2, maybe that would that help people absorb stuff, I think.
Sure, fair enough, sure.
Okay, so questions. My screen, now Greg Potter, my screen is now, so I only see a few people. I don't know if anybody's got their hands raised. Is that how this has to be when the screen is shared?
You have arrows, Martha, at the bottom of your last picture. You'll see an arrow and you can scale down and see everyone else there.
Okay.
Underneath your last person.
Yeah.
You hit that arrow and we'll go to everybody else.
Got it. All right. Deb, I see your hand up. Thank you, Jason.
Yep.
Yeah, thank you. I'm a little concerned as a retired person myself. I understand that subsidizing people's insurance forever and ever is not sustainable for the county, but you know, a $263 a month hit right off the bat to a retiree's budget may be a little hard to take. Is there some way we could phase that in over a couple of years so that people would have time to adjust to that?
You mean for the group that the 68 people who are on the platinum right now, right? The ISS.
Yes, ma'am.
Yeah.
So that's probably the most challenging part of this whole discussion, Deborah, to be honest with you, because that specific group of folks has a benefit that's only been in play for about 2 years. A portion of those folks had moved from Classic Blue or PPO, so they were paying significantly more probably prior to 2 years ago. And then this benefit was created about 2 years ago as a means of providing a more cost-effective way of providing retiree health care. It was probably a reasonable interim step. What probably should have been done at the time is this discussion that's being had now about Medicare supplements coming into play, and have the 50-50 share with a platinum as the option. It didn't. So we have to manage a third of the Medicare eligible folks that are getting that extensive, essentially free healthcare benefit. To answer your question in short, yes. If you wanted to do something, there could be a way of phasing it in, say over the next 2.5 year period of time, all of it kind of accumulating on the January 1st, 2023 date. And that's a math calculation that can easily be done, and is not unreasonable to do considering the circumstance. The only difference is that you'll have 2/3 of the existing Medicare eligible retirees shifting over into the Medicare supplement, within the next 6 months or so, and then that cohort of third could be shifted in just a slightly longer period of time. But to answer your question directly, yes, it can be done.
Couldn't they be shifted, but just the cost not be entirely shifted to them at once?
The way you'd probably do it is you would gradually increase the percentage share over that 2.5 year period of time, or 2 year period of time. That'd be probably the easiest to administer, Martha.
That would work.
Yeah, I will add, I'll jump in now with this, is one of the things that we think we should add to the resolution is that the MS4 plan itself should be reviewed after 2 full years of being implemented with respect to the premiums being paid and the claims being paid. And this is a consortium Excellus discussion more so than it is a county share, retiree share discussion. Obviously, there's a negotiation that goes on between Excellus and the consortium with these premiums. And we think it was brought up by one of our retirees that we shared this with. It's a very good point and is well positioned that after 2 years of implementation, if we move forward with this, we should definitely review that to see what type of usage of the plan, what are the premiums, is it being made? Are the claims significantly lower than the premiums? And if so, the premiums should adjust accordingly. It's a good accountability mechanism. So we will add some language to the end of this resolution, but that's kind of a start, but yes.
Okay, Mike Lane.
When we first started talking about this last fall, my comment was we need to talk with the current retirees, many of whom have been quite vociferous, complaining that we don't treat them as well as some other municipalities treat their retirees. I wondered what efforts we've made to talk to the existing retirees to bring them into the conversation about this change, or are we just going to say, well, we're just going to make you do it? That's one question. And the second question has to do with this MS4. Is that a true Medigap policy? And if so, does it have the various levels that most Medigap policies have? I don't know, the A, B, C, D, or whatever they are.
I can answer the second question first, Mike, and that is it is a hybrid. It's a supplemental policy, so it is a Medigap policy with a prescription drug coverage. So it's more than Medigap, whereas most Medigap coverage only covers the medical portion, and then you would have to go out and get a Part D plan to cover the drugs. This is all in one. So it was created. It's a product that Excelis offers the consortium at a negotiated rate.
But I think in Medigap plans, there are like A, B, C, the amount of coverage they have. I'm not talking about prescription as much, and the people they have different premiums for that. Is that the same here, that they'd be able to choose among these?
No, it is one distinct plan, and currently the consortium offers 2. They did offer 6. They just voted to eliminate many that just weren't being used. So there are 2 now to choose from which to choose. This one is the less costly of the 2, and it still has very, very good coverage.
And do retirees have the opportunity to continue dental and any optical that they might have?
That would be more of a question for Sarah. Sarah, can you discuss medical or dental options?
Sure. So currently our retirees don't have access to dental or vision coverage. So this plan just doesn't have the vision or dental coverage. So that would kind of just be the same in terms of that. It just doesn't cover that. So.
Okay. And then the question I had, Jason, about talking with current retirees.
So we have spoken to a few retirees, Mike. We've had some conversations, some folks that have been in the benefit world in the past. So we have had some conversations. We have had a few. Obviously, we haven't done any broadcasting of this until we have this conversation with this group. And we've also had regular conversations with the consortium as we've started to develop this, trying to understand how we can ensure that there's continued comprehensive coverage and it's at a manageable cost. So to answer your first question, yes. The second part of that is that we don't provide lucrative retiree benefits. I would argue that that is not an accurate reflection of the benefits that we provide. Having worked in the state now for 20 years, seeing where other retiree benefits are municipality-wise, I would say we are on the better than average element of things of retiree coverage, including what's being proposed through these 4 proposals and the changes moving forward. It's still excellent comprehensive coverage, both 55 to 64 and then 65 and above for a Medicare supplement. So I think a lot of that is about a more personal perspective with individuals rather than a comparison of facts versus other municipalities and what they provide their retirees.
Thank you.
Okay, I have a couple things. I don't see anybody else I'm missing. I don't see any other hands up. Okay. Let me ask, and I sent an email that I copied, I think, to everybody, or at least the committee. Jason and I corresponded last night and this morning. So this one he bumped to Lisa and Sarah. So my question is about the word duplicating. You say right now, the blue PPO and platinum plans duplicate the full coverage of Medicare. So does that mean that, in fact, something's covered by Medicare? If it's not fully covered, if there's a copay, whatever, does that mean that, say, the PPO or the blue actually picks up some of those costs like a Medigap? Or is it just like it's literally identical and it wouldn't be covered by the PPO either.
Martha, what the latter of what you said is correct. And I think Sarah could speak more to it. But right now, for retirees over 65, Medicare becomes the primary payer. So often those claims don't even hit these plans that we're paying full coverage for. It's only those costs that Medicare does not pick up that are being hit to the current plans, PPO, Platinum, Classic Blue. Sarah, do you want to jump in?
That's what I mean. In other words, if something isn't covered fully, it would go to our plan.
That's correct.
Yeah.
Okay, so it functions like a gap, like a supplemental, no?
It does, but it's an excessive coverage.
No, right, I get that, okay.
Yeah,
All
it
right.
functions as a gap, yes, that's correct.
Yes.
It does function as a gap, so we're not getting nothing for that, but we're getting not nearly what we ought to get, okay. And then Jason, you wrote, I wrote that seems like the current retirees would have until January 1st, 2021 to move over to the MS4, and then their bills will go up. And you wrote, correct, if they choose to stay with the county. So in other words, all the Medicare eligible plans under the scenario would go to MS4. Their only choice is to get health insurance, get coverage with their spouse or something, to leave the county's system altogether, right?
Right, so a little bit of a misnomer is that not everybody takes retiree health care from the county when they retire. They have other options. They have spousal options. They have other options that better meet their needs. So, as long as people want to continue to utilize the benefit that the county provides, they can continue to stay with it. They can end at any point, any time. They're not obligated to stay on if they so choose. And a lot of people don't. They have better options. They entertain or they go pursue. So, to the extent that they stay with the county's plan, yes.
But some people may not have another option.
They may not, or they may not, like I said, each individual retiree or employee's circumstances are different as to what meets their need. So there may be a Medicare gap plan or Advantage plan that may be cheaper and they may feel more comfortable using versus this. I mean, there's different options that different people take for different reasons.
In other words, they would just take their own money and buy a Medigap plan.
It could, and it could be cheaper, but the coverage may be less, and that may be a choice they make.
Okay. Okay, I think that's what I've got. So, and I do want to say that it seems like, it's 68 folks is a significant number. I do think it would be fair to spread that out over a couple of years. That's a big jump. Even though it's true they've gotten a really good deal for 2 years. I think what we did 2 years or 3 years ago when we set this up was trying to move people to platinum and make it, as attractive as possible. And obviously we made it really attractive. So, okay. So anything else on either 1 or 2? Proposal 1 or 2. Okay, great. Deborah, your chat says, Martha, it also means you're paying premiums as if the policy was providing coverage that's actually provided by Medicare. So your premiums are higher. Okay, great. Thank you.
That's why the individual, one of the things I think to draw to is you have 2/3 of retirees. Some of them, can stand, up to about $6,000 more in savings. And put in other ways, they've been paying excessive premiums for a lot of extra coverage. So when we talk about the 2/3 of the existing Medicare retirees, they stand to save money over this transition and still have good coverage.
Right. Understand. Just the final note on this is that you mentioned about providing counseling, support to folks as they try to sift through these things. On this, as well as the early retirement program, I hope that where we are sending a good number of people to, whether it's BevChin at the Human Services Coalition or whoever else, if we can make sure we're supporting those nonprofits that might be, diving into a whole bunch of extra work on a short-term basis to help us with this. I would support that.
Yeah, one of the things we've talked about, and similar to the way we address the furloughs, is to really have a robust approach of education. I do think that part of the circumstances on some retirees getting into the situations they are is because there was a lack of education handoff on our part, which we can definitely do. We can work hand in hand with COFA, and we can work hand in hand with Lifelong, as well as HST, to ensure that people have access to understanding all of their opportunities and all of their options, and ensure that safe transition takes place. We've talked about how do we beef up that support and ensure that support remains there. I know even since Sarah's been on, Sarah does extensive exit, retirement counseling, or provides them with an overview of their retirement options. And there's probably more we can do as we talk about this transition, if this is something to move forward with.
Okay, great. All right. Any last questions on 1 or 2? Okay. All right. Go ahead. Thanks for the pause, Lisa.
Oh, absolutely. It was a good idea. There's a lot to take in.
Yeah.
So proposal 3 is where we're getting at the retirement incentive for current county employees. And so this is structured that it would be eligible to employees who are age 55 or over with 10 or more years of service. We were asking that employees notify their department head and human resources of their intention to retire in this year by submitting a letter by July 31st with a retirement date that would fall between July 31st and December 31st. What we're saying is that for employees who are under the age of 65, they could retire and keep their current plan at the 20/80 cost share, 20% retiree, 80% county. And that would be effective through December 31st, 2022. So 2 full years or more. Here's the slight change that we're saying employees age 65 and over, as before, they all would be going into Medicare supplement plans. And we're suggesting an incentive rate of 20% retiree share, 80% county share for that same time period through 2020. And anyone who...
I'm sorry, is that the error you were talking about?
Yes.
Oh, that's a big deal. Oh, okay. Yeah, that's a big error. All right.
Yeah.
You'll see it more on the next slide in simplistic form. This is an error on our part, Martha.
Okay, because when I read that, I'm like, well, this doesn't sound like any incentive at all. Okay, so it's 20 for folks.
Yeah.
Okay, 20. Great, thank you. Okay.
Yes. And so employees who retired from the county prior to, assuming that the legislature adopts this incentive, employees who retired prior to that would not be eligible. We are saying here that this incentive would potentially save new retirees anywhere between $600 to $25,000 during the two-year incentive period, depending upon their specific plan that they are in and that they retire to, whether or not they have dependents, if they're on a family plan, and or if they are Medicare or non-Medicare eligible. So it really depends upon an individual's circumstances. And the savings to the county here is not necessarily in the incentive cost. It will cost the county something, but the savings is achieved through the vacant position. And we're saying on average, that would be about $87,000 in savings for each vacant position achieved here.
So the other savings so the up to 25,000, that's over the 2-year period.
Yes.
Is the 87,000 average savings, that's per year, because that's assuming that's the average position you might save?
Correct.
Okay.
Yes. And that includes the salary and the fringe costs.
Right. Okay. Thank you.
And then finally, the fourth proposal is that effective after, well, for any retirement announced after July 31st, the rates for individual and family platinum rates and MS4 rates would be at a 50-50 cost share to the retiree and the spouse, and 50% to the county. And that retirement into state and local retirement would be required. So that would be the rates that would apply going forward if one did not take advantage of the retirement incentive. So this is coming up on our last slide here, which is really a summary of what we just discussed. So you'll see in the first row down, the first column down is where we are currently with our rates for retirees under the age of 65 and 65 plus, putting them all into the effective percentages. The second column is our proposed, where we're going to clean up those rates for the under age 65. The incentive rates, which is a 20-80 split for all of the age groups and the plans. And in the future, for non-incentive employees would be the 50-50 split. Again, the proposed rates for the current retirees under age 65, we're saying that those rates would be effective on January 1st and would stay in effect until this cohort reaches Medicare eligibility, because they are, they're a finite group, and it will be less than 10 years for them. For the incentive retirees, those plans and rates would be effective upon their retirement, any retirement announced before July 31st, and put into effect by the end of the year, and be effective through December 31st, 2022. And then the future retiree rates would be effective for any retirement announced after July 31st.
And for the people who take the incentive, they get the lower rate, they get 20-80 for 2 years, and then they go to 50-50?
Yes.
Yep. And yep.
Deborah.
So there's I'm sorry.
Deborah, do you have a question? That's good.
Yes. First, I want to thank Lisa, because the charts in this PowerPoint make this much easier to understand than the memo.
Yes.
I'm hoping that when this gets presented to the ledge, you'll send everybody the PowerPoint slides. But also, I have a question about how many county employees would be eligible to take advantage of this incentive.
Yes, so I don't have that chart right in front of me. It's somewhere.
That was 130-ish.
Something like that, yeah. We had it.
About 100 that were between 55 and 64, and about another 30 that were 65 plus, give or take.
Thank you.
Thank you.
Yep. Yeah. So,
I'm sorry, would you give those numbers again? You said 130 who are under 65.
No, about 100 that are between 55, 64, the young retirees, and then about 65 plus is about another 30 that are eligible.
Okay, great. Thank you. Go ahead. Thanks, Jason.
I was going to say that the kind of the converging date here is January 1st, 2023, where you have a lot of where you would ultimately achieve consistency with existing retirees and new retirees moving forward into, moving forward, because the incentive folks would be shifting into the 50-50 share on the platinum plan. Any retirees post 7/31/2020 would be in the 50-50 share in the platinum plan. Medicare eligible would be the 50-50 split with the MS4. The only folks that would be outstanding, which will certainly age into that Medicare supplement piece, would be the folks that are under the category of proposed that are under 65 now, and they will slowly, within less than 10 years, be over into that. So point being is that in a few years' time, well, first of all, immediately you'll have a much better way of being able to calculate calculate premiums, And then as we go on through time, not only will you continue to have an exceptional benefit for our retirees, you'll also have consistency and equity across the board with respect to folks as they take advantage of retiree benefits. That's why I said if you wanted to scale in that 68 retirees that are currently taking advantage of the Platinum Individual Plan, you could scale it in over the course of the next 3 years, 121, 122, 123, up to that 50-50 mark. So it's a little softer landing, so to speak.
So that on January 1st, 2023, they're now in the same bucket. So that's 2 years. Okay.
So it's like, so for example, if you went to a 1090 split on 1/1/21 and a 30/70 split on 1/1/22, and then a 50/50 split on 1/1/23, you've achieved, I think, what you're asking for.
Right. Sounds good. All right, Mike Lane.
I guess I just got to come back to this question. It was a surprise what Sarah said, that retirees aren't allowed to take take their dental insurance with them. I wondered why not, and it seems people's need for that doesn't end when they're no longer employed. Have we looked at this and whether there's anything we can offer?
If I'm not mistaken, we don't offer dental. We don't provide dental now. It's a supplement plan that people take out on their own. Is that correct, Sarah? If I want dental, I take it out on my own as his vision.
Yeah, it's something that we haven't offered, and nor does the consortium have a retiree dental coverage. Though I understand what you're saying, that of course retirees do need dental. It's just something we've never had.
Be interested to know what it would take to have people be able to have that at the consortium level. Thank you. I don't expect an answer. I just kind of be interested.
Sure.
Okay, I see Ann Carmen and back to Deborah.
Thank you, Martha, and thank you for the presentation. The two quick questions. I think since the people in the 55 to 65 age group, they listen to traditionally a lot of hard rock, such as Led Zeppelin, wondering if these plans cover hearing aids. And then for a more serious question, for the second proposal, there was an estimate of how much the county could be saving. For this, is there an estimate how much we could be saving per person, or for a certain number of people took early retirement?
So,
First question on hearing aids.
were you going to answer that, Jason?
I don't know the answer to that question.
I can attest to the need for them.
I do.
So you said you didn't hear it, Jason.
Yeah, you're going to have to speak up. I can't hear very well here.
Currently, this plan does not cover hearing aids, but neither do any of our other health insurance plans. So that's not something that our retirees, unfortunately, have access to on Classic Blue, PPO, or Platinum right now either. So.
Thank you.
And then the potential savings, we said that would be somewhat difficult to calculate because we weren't certain how many people would necessarily take advantage of the proposal itself. But if they did, it would be calculated, it would be on average, the vacancy would be about 87,700 annually per vacancy. So, we would assume that if a number of people took the incentive and they retired, there are certain positions that we would certainly need to fill right away, and we would, but there would be some that we could hopefully hold vacant for a period of time, and that would result in some savings and would also result in our hopefully not having to lay off individuals as a result.
Several things I'll add to that. That's right, Lisa. Several things I would add to that is folks that would be retiring are most likely going to be tier 3, 4. There might even be a tier 1 or 2 in there in terms of retirement systems. So any replacement that may happen in future years, or even immediately if you fail the position, it would be a tier 6 from a retirement perspective. Also, any new employee coming on would be going into the Platinum plan, where generally a big portion of these retirees, I want to say nearly 90% of the eligible eligible employees for this incentive are classic or PPO candidates. So I think there's literally 10 folks that have a platinum plan that are fit in the eligible retirement category, that 130. So you would be getting newer employees if you were to fill them under a different tier system, most likely, unless they were transferred from a different community, and they would be coming into the platinum.
Sean and then Henry.
Thank you. I was wondering, I know that this is like essentially the first round. Is the game plan to see if anyone wants to do this? If only a few want to do this, is there a certain cost perspective that you're looking at saving? And once that's met, we move forward? Or if there aren't many people that are interested, would there be another round where you would offer a better incentive?
I don't know. I think this is I can't say that for sure, but I would imagine this is the incentive. If people take advantage of it, they do. I mean, so all of these proposals, while they're separate, they really are intertwined. It's really, you really can't adopt one and not the other because they have consequences and they balance each other. So for example, folks that may not take it, the retiree benefit will change moving forward after the incentive date. So that may be an incentive to take it as well. So I think I feel comfortable saying that there wouldn't be another incentive at this stage of the game other than possibly opening it up again, but I can't see that happening. I think we did speak to union leadership and we did speak to the department heads about what interest there may be about retirement incentives. We think we captured a lot of that. So I think you'll have a decent amount of folks taking advantage of it. And then it's a question of the risk you always take with that is what positions may open up, which positions you definitely are going to want to fill, which positions you may not be able to fill. And that's a risk, you take a little bit when you do this.
Right, because you have to offer it to everybody, not just the people you want to retire.
Right.
Great. Thank you.
Thanks, Sean. Henry?
Yes. So if this resolution is passed now and passed by the ledge, you'd have from June 16th to July 31st to decide?
Yes.
And what happens if someone already announced they were retiring before you pass this? Will they be able to unretire and retire again?
If they have retired, no. But if they have announced or they intend to retire in that time frame, then they would capture the incentive. So if they have ended service as of the date before this resolution is passed, they would not get the incentive. If they were going to announce their retirement July 1st, even though they announced it several months ago, they would capture the incentive.
Okay.
I think that's a very small, less than handful of individuals if that is the case.
Sean, is your hand up again? You're still up. Any other questions? All right. Lisa, you've done what I think is a miracle because I was really scratching my head a lot last night as I read this. I think making that fix about 2080 instead of 50/50 answers a lot of questions because I couldn't figure out how it was actually any kind of incentive at all. So, all right. So, Jason, are we ready, committee, to actually put the resolution on the floor? I'm seeing some sort of yeses. All right. So do we have a need to continue sharing the screen? Does it, should we?
Great.
Sorry.
Sure, I can. Here we go.
Okay. All right, great. All right, Jason, do you want to look at the resolution and tell us what it is
Sure.
to change?
So I'll take the stuff that came first, and then maybe the last part of those three elements. The last part of this we should come back and talk about. So if I go down on the second page of the resolution, Roman numeral 3, and that would be Roman numeral 3, section A, subsection 3, 4, 5, and 6. In each, and correct me if I'm wrong, Lisa, in each one of those subsections that I just announced, 3, 4, Roman numeral 3, Roman numeral 4, Roman numeral 5, Roman numeral 6, where it says 50/50 share, 50 retiree share, 50 county share, it would be changed to 20 retiree share, 80 county share. Is that correct, Lisa?
Correct, yes.
All right.
Okay.
This
Is that
incentive,
even for the spouse?
yes. Because right now, if you're on a family plan, you're getting it at a 2080 share. So this, if I go to subsection B, this incentive will be in effect of the cost sharing until December 31st, 2022. That would stay the same. Effective January 1st, 2023, all retirees and spouses under this incentive will move to the platinum plan if not Medicare eligible at a 50-50 cost share. That is correct. Those that are Medicare eligible will move to the Medicare supplement 4 plan, 50-50 cost share. That is correct. I think that's it. Is that correct? Lisa, are we missing any parts of that?
That's what I've got. Yep.
Okay.
Okay. And if you could send the track changes version out after this meeting so everybody can see. Okay.
We'll sure do that. Lisa, do you want to talk about maybe another resolve about the review of claims? And Lisa, Kathy can write it down. Then right after this meeting, we'll send you what we put down here, Kathy.
Yes.
So I think it's probably a resolved. It can go after. It can go in any resolve. It doesn't have to go in any order. I don't think.
Yes. That, let's see, so did we say no later than July of
First.
2023 that the county would review claims and costs of the associated with the MS4 plans and review the rates of the MS4 plans
With the yes.
Offered by the consortium.
Yes.
Review and with an eye towards reevaluating the program, or is that what you're?
I think it's a review of the premiums and the claims. So, Kathy, I don't know if you can read that back to us.
I have no later than July 2023, the county would review claims and costs associated with the MS4 plans and review rates of MS4 plans offered by the consortium.
Yeah, so what that is saying is that we are doing a rate review with the consortium based on the claims paid and the premiums paid over that full 2-year period of time.
Yeah, and I guess I would include both prescription and medical claims paid for the Medicare MS4 plan.
So like I said, this is more of a consortium Excellus discussion than it is about the plan, about the program that we offer per se in the retiree county share. It's really about claims being paid and then premiums being paid, and are they reflective of each other? You know, the premiums reflective of the claims.
Okay, does everybody have that idea? All right, and that would go yeah, wherever it'll go somewhere.
I would make it the actual third resolve. So the first one would be that the Department of Human Resources collaborate. The second one is that the legislature authorize. The third one be that. The fourth one then be that this resolution and all changes. Does that make sense, Kathy?
Yes.
Okay.
That's on that last page. Okay.
So,
all right.
There's one more that I think you had mentioned through the discussion that I want to map out with you, if that's all right. This has to do with Medicare eligible. So there's folks that are currently Medicare eligible and on the platinum plan. And this is that 68 or so individuals that are on that are Medicare eligible, paying the equivalent of about $25 a month for the platinum individual plan.
Uh-huh.
And what we talked about and what you had just mentioned with this group is perhaps spreading out that cost over a 2.5-year period of time versus hitting it, going right to the 50-50 share on the MS4 plan. What I would suggest, or what I can propose, I can find my notes, is that effective 1/1/21, it go to a 1090 split retiree county. On 1/1/22, it go to a 30/70 split retiree county. And on 1/1/23, they go to the 50-50 split, which would then be consistent with all the other Medicare eligible retirees.
Okay, because right now they're at something like 4/96, right?
Oh,
Yes.
just to be sure, that's a little bit of a mixing percentages. I think the best way to look at it is right now they are paying $25 a month. That $25 a month for the platinum plan would equate to about a 5.95% share in the MS4 scenario. So in this case, going to a 1090 for the first year is a $25 increase per month. So it's not not an unwielding change. Not to mention, for that extra $300, they'll actually have a decrease in copay insurances in certain areas. So it's about a wash for the first year. Then it would go to 30%. Then it would go to 50-50.
Okay, and then so that would be another resolve, right?
No, it wouldn't be a resolve. What we would do is we would go into section 2 on the resolution, and we would add another letter here, and we would do what I just explained to you for discussion purposes. Those that are on the platinum individual plan right now that are Medicare eligible as of 1/1/21 would go to a 1090 split, 1/1/22 would go to a 30/70 split, 1/1/23 would go to a 50-50 split.
Okay.
And that's what we would insert that into, section J or whatever you want to call it. We would include that in section 2 of the resolution.
Okay, everybody clear on that? All right, Jason, you had written in the emails that we traded that for that group of people, the way the retiree contribution is calculated, it transferred county savings to the retiree. Therefore, the county has not saved any money with this proposal. So there's no, is there any, that, in other words, that's simply where the county paid the difference in the premiums instead of the person, and so there was no savings.
Right. So under the current, when this was adopted 3 years ago, what was done is that the county cost equivalent to the classic plan, when an individual retired, whatever the county was paying was then that equivalent dollar was transferred to an individual if they were to take the platinum plan. So their contribution was significantly less because we were paying the same portion of the classic plan. Correct me if I have this wrong, Sarah or Lisa. So in essence, we didn't gain any savings. We shifted all the savings to the retiree.
Okay.
Which is why, if you notice in number 1 of the resolution, the individual platinum plan continues to be the 25/75 share because they still have a smaller share. And we continue that forward until they were Medicare eligible. So those folks that had selected that will continue to receive that reduced share versus someone that wanted the classic or PPO.
Okay. All right. I have one other piece, and this was also in our email, and we've talked about it a little bit about that employees have to notify department head and human resources of their intention to retire as of December 31st. They have to tell people July 3rd, have to make it official July 31st. So is that, I know you want to offer counseling. I just know, having gone through it recently with my husband, there are multiple stages of those conversations a family has to have. It's complex, and it's fair that people maybe haven't been thinking about it yet until they see what the real dollars are, to see what the real incentive is. So we can't expect people to have already pre-decided to do this until like, at least right now, they had nothing concrete to consider. Is there any possibility of moving that July 31st, let's say, to August 15th, or does that just totally mess up your budget, the budget calculations and what you need to know?
No, it's a discussion we've had at length, and had we had this together 4 weeks ago, we would have brought it 4 weeks ago, and the deadline would have, still would have been July 31st. I think moving it to August 15th is not unreasonable. It provides a 60-day period, window period. It also provides time for departments to react as we put the budget together. So, we're not married to that date for any particular reason other than we tried to find a reasonable date to do it. If providing another 2 weeks is manageable, I have no objection to it. I don't think Lisa does. I don't think Sarah does either. The more time, the better, and it'll help folks be able to make a very difficult and challenging decision as they move on in their life. So if that's the desire of the committee and the legislature, we have no problem changing that date to an August 15th date. But just out of question, just to make it easy and round, what is August 15th? It's a Saturday, so I would do August 14th. I'm sorry.
Okay. All right. Is that something you're willing to just change here to have that put on the floor?
We can think it's, yeah, I mean, that's not concerned. It's not an issue for us. If that's the way the committee would like to go, we'd be happy to do it. And it's fine. Yep.
Okay. I appreciate that very much. All right. With all those changes, and I'll leave it. What?
Kathy had a question.
I was just going to say that the resolution is already on the table.
Oh, thank you for reminding us. Great. Okay. Any further discussion by the committee or by any other members who I see on the call here? Mike Lane.
Were those changes friendly, or do we need an amendment?
Well, that's a good point.
I'd move the amendment as discussed to move it to August 14th, plus the additional resolve that we discussed.
All right, so that's friendly with you. And who was the seconder?
Deborah Dawson moved it and Dave McKenna seconded the resolution.
Okay, those changes.
It's friendly to me, but include the addition that Jason made to section 2 about phasing in the increase in cost.
Yes, fine with me.
Yeah. And Dave McKenna, you moved it, so that those things okay?
No, that's fine with me, Martha.
Okay, great. Mike, is there anything else?
No.
Lisa?
I just have a point of clarification for when we're rolling this out. So we are stating that employees must notify us by August 14th. I'm noticing in the resolution, it says the retirement date must fall between July 31st and December 31st. I would like to change that if possible to the retirement date must fall between the date of the enactment of this resolution, when the legislature acts on this resolution through December 31st, so that can capture any employees who have already submitted their resignation, and they would be willing, or they would be able to take advantage of this.
Okay. So in other words, which also indicates that if somebody sees this on, when we vote it and they go, wow, that's great. And 2 days later they sign up, then then they can go ahead, right?
Yeah, it's a good catch, Lisa.
All right. So the retirement date must fall between the date the legislature adopts this and December 31st.
Yes.
All right. Let me just try to review. So I got,
wait a second. There's also the second resolve that currently says that the Health Consortium has to make MS4 plan available to Tompkins County retirees effective August 1st, 2020. Does that date need to be changed also?
No, that has to do with them operationally getting set up. So essentially, if an eligible retiree that's Medicare eligible wants to do it tomorrow, they can't. They have to do it August 1st.
all right. So I will ask that we get a track changes version sent out a couple days, to all legislators, and a clean version. That would be great. But let's just review. So I'm seeing and I'm sure there will be other things we find. So, but here's the intent that under the first resolution, and then section 2, number H, we have changed. We've added J. 2, we've added section J, changing the time interval, and there's glide path for those 86 folks. On the next page, which on C, we're changing the date to August 14th. We are adding a resolved about reviewing the claims and costs, and that's the second to last resolved. And the changes about 50/50 going to 20/80. Those will be fixed here as well. That summarize it? Okay. Are we ready to vote? All in favor? Let's see. Mike Lane,
Yes.
Dave McKenna,
Yes.
Deborah Dawson,
Yes.
Donna Black.
Yes.
And I'm a yes, so that's unanimous. And congratulations. This is quite a big step and a huge amount of work. And I know that the work isn't finished. You have a whole lot of work to put this in place. I think a lot of these changes have been long overdue, as you've said. It's great that you've really kind of grabbed a hold of the whole thing. And we're trying to do a lot of things in one move, but I think this makes a lot of sense. So we will, and if you could send out the slides as well to all, yeah, and copy the whole legislature. Does the committee feel, do you have any interest in getting back together once we see in writing the final resolution? Do you think there's any need to meet before the ledge meeting? Good.
No.
Shaking heads no. All right. Lisa, Jason, Sarah, thank you very, very much for this. This is quite something. So
Thank you for having us.
yeah, absolutely. For my report, I just, one quick thing. I have wanted to see if we can do something for our 25-year employees. We didn't have a dinner this year. I would like to see if there's something that we can do, and in particular for the employee who's who's served 50 years. So I wanted to let the committee know that I've emailed Jason and Lisa about this, and I hope we'll be doing something
Yes.
to recognize everybody and try to make it as somehow festive as we can.
Martha, I got your email. I'm sorry I didn't get back to you. We can definitely recognize all the employees in a resolution of some sort, maybe either in later June or early July meeting. I will say the employee that has half a century of service has asked not to have much fanfare. So we will have a subtle thank you to them coming up later this week, but they've asked to really remain private. So we're going to respect that, but we can definitely include their name as well as all the other folks that hit 25 years this year in a resolution recognized by the legislature, and go from there.
Can we send her little fans?
We have.
You said she wanted a little fanfare, so.
Little. We've given her. We have a nice, and I can report on it probably on Tuesday. A very nice vase from Corning that was made especially for her, engraved in it. And Leslie and I are going to meet up with her later this week. Wonderful person, wonderful employee. We'll thank them many times over, and we'll definitely get some pictures and share it.
That's wonderful. And, you know, our deep, deep gratitude. I mean, and, you know, full admiration for a half a century of service. That's really very, very wonderful. So, all right. Thank you for respecting her interests and preferences. So thank you. Ann Corman, I see you're still there. Would you like to update us on WDIC?
Let's see. I really wasn't prepared, but I probably should be, huh?
If we want, we can come back to you.
Okay, yeah, if you come back in a minute.
All right. Jason, do you have any other report as county administrator?
Other than, I said it earlier that, healthcare is probably the most contested issue at the bargaining table. It impacts everyone personally. It's a very difficult issue to address. I want to commend Lisa and Sarah just for committing an enormous amount of time to understanding it, being able to easily explain it, and then being able to come up with solutions that I think really work for everyone, for the retirees that exist, for new retirees, the incentive itself. It's a very complicated issue, but I think these proposals, if adopted by the legislature, really streamline a lot, continue to provide comprehensive coverage to our folks, and really I think is a testament from an employer of choice perspective, continuing to provide excellent and comprehensive health insurance for active employees as well as retirees. So I just want to thank them for their hard work. A lot of frustrating nights and days trying to understand it and get through it. And they're definitely a whiz at it. And we'll hopefully this will go forward on Tuesday and we'll be able to implement it. And we will make the commitment, as we did with our employees through the furlough process, to ensure that every retiree that needs that support or needs the guidance and the counsel can get it, and we can link them up personally with someone to help them make the decisions they need to make. We're going to take a very proactive effort in that to ensure that that they get the support they need to make those decisions.
Thank you. You're planning to go through this whole presentation on next Tuesday night?
We can. What I was just thinking of doing also is that I can update the memo that I put out and actually add to the memo part of this discussion that discussed the Medicare eligible folks in the Platinum Plan to kind of give some context so people can understand it, if that works for everyone as well.
Yeah, I definitely would. But I think from the point of view of employees or retirees who want to, listen in on Tuesday night, and legislators who may not have a chance to wade through the reading, I would assume it's certainly worth spending some time at the legislature to do a presentation on it. Shauna?
What might also be helpful is you can link this YouTube video and then point out the time frame that we actually had the discussion. That might help our colleagues catch up on the conversation and maybe not ask some of the same questions that we've tried to work through. And it might also help some of the retirees understand the logic and the decision making that took place today.
Be happy to do that. That's a great idea.
All right, great. Thank you. Any questions for Jason? Mike Lane.
Jason, I think I just read today that counties in the phase 2 can start bringing back their non-essential employees if we meet the metrics. Is that the case? And are we going to be doing that?
It's a good question. So we understand the executive order is that once you are 2 weeks into phase 2, you are no longer required to meet that 50% threshold, therefore no longer required to pay employees if they cannot work remotely, if they're not essential. So the emergency leave provisions technically can end technically this Saturday. So we just had a brief conversation before I got on this phone call. Amy and Jay Franklin and a group of folks are getting together tomorrow to talk about a bunch of directives with respect to coming back to the office. So we haven't quite made a conclusion yet, Mike. My directive to the staff was I do not want to bring people back unless we have at least a few days of directives that are out there so people understand the expectation coming back. We kind of got ahead of ourselves the last time around, and then we got reversed through the state's executive order. So it's possible we could bring them back on Monday. If not, it may be Wednesday or the following Monday, but I would say no later than a week from Monday, we'll be bringing people back. That said, the key component to that is that not everyone will show up at work. We are still implementing a structured process for our own folks to come back. So while there will be no employee that will be eligible, that will be basically, we will discontinue emergency leave, folks that still have childcare issues, that are non-essential workers can still execute and utilize FMLA, and a lot of them have already completed those applications pending the termination of emergency leave. And folks that can continue to work remotely will continue to do so. So each department in their groups did a great job kind of phasing people in. Our phase 1 is this next step, and those that can work remotely will continue to work remotely. Like my office, again, I think we'll keep our building closed for the month because there's a lot of people that can work remotely. We don't have a big demand of in-service need or in-person service, or it can be done through appointment. And then phase 2 for our internal operations, we'll start to gradually have more in-person access into July. So right now, I got to wait till tomorrow to see what the group comes up with. But yes, we could technically open as soon as Monday. What that really means is that different departments will have to communicate out. We'll continue to work remotely, continue to have some in-house staff. There'll be some departments that'll still be appointment only, and then we'll slowly transition into a more traditional reopening or a more traditional in-person presence.
Thank you.
Yep. I will add one thing: the DMV's was shut down by a separate executive order. There should be a new executive order coming down today or tomorrow that says DMVs will be able to be open, I believe, next Monday for appointment only in-person service. So Maureen, I just sent that out to Maureen a little while ago, and we'll have to figure out what comes from that executive order to work with her and her team about how they can manage that.
Thank you, Jason. That's a good question, Mike. And I would encourage that we really be sort of err on the side of, if things are working okay with people working remotely, let them continue to work remotely. I don't feel any, pride necessarily of having our doors open. If, the issue is service. Are we providing the service that people want and need? And, frankly, until we have a vaccine, I don't see the disease is still the disease. So I appreciate that, really being very thoughtful about it. And also the recognition that some people are going to have childcare issues as long as the schools and childcare programs aren't where they need to be.
So we use Zoom, like we're using Zoom right now. We have an application, Teams, through our Microsoft Office software, which is essentially the same thing. And every employee that has a desktop or laptop has access to Teams. So when we can do our meetings very easily through Teams, we're starting to utilize it a lot more. Not everybody needs a Zoom license because everybody has a Microsoft Office license. So, but that has email, that has a desktop or laptop. So we'll continue to use that for our primary meeting structure. And I think a lot of people took that message when we sent it out, and they're slowly coming back as they see fit. Like I said, our building, I don't think will open to the public again for a few more weeks. We don't have a need to. Finance is doing things as an in-person process. HR is doing an in-person process. So we're taking that advice and we've really taken the perspective of going into this slowly and gradually. There's no reason to rush if we can still get the work done.
Appreciate that. That's great. All right. Thank you. Rick Snyder, finance report.
I just wanted to report out today that we did get our first check for last month's sales tax, which is really for the month before. We were down 31.2% in that sales tax collection. So there's one more check that we'll receive in about 2 weeks towards the end of the month, and that will be compiled with the first check that we've got. And I just thought I would give you that particular statistic. Jason, did you want to say anything else about sales tax?
Other than there's a slight bit of good news with that, and that we had actually projected a 36% decrease for this sales tax for this month. That said, we still have another draw coming this week, I think, Rick?
2 weeks.
2 weeks. So there's more to come, but if it stays around that, then we may, it'll be, let me say this, it would be on the milder scenario than a severe scenario from when I presented the budget review, and that we've been pretty on point so far with sales tax projections in a bad way, but we've been on point with it.
So Rick, that's really finding lemonade, Jason, out of those lemons.
Yeah.
Thank you.
Yeah.
Rick, are you saying that was the month of May or the month of April's report?
Well, we always call it the month of May, and historically, we go with what the state calls it when they transmit it to us. All the counties call it the month of May. As we drilled down into this and we looked at it 6 months ago and even 3 months ago, a lot of finance directors, treasurers were looking to where are the roots of these payments, and it really goes back to the month before.
Okay, yeah.
So when we get money in June like we're getting now, that's for money that the state collected in May, which was actually generated in April and the first week of May in the localities. So there's always been that time lag difference.
Right.
So
So now,
it hasn't
yeah.
been recently that we've been drilling down and try to pinpoint a little bit more accurately what's the exact period that it covers.
Right. And I think you're re-educating us on that. I just wanted to confirm. So that's actually April's sale with 31.2% down.
Right.
Okay.
Which we all can recognize was a very bad month.
Right. So that was the full month as opposed to
a full month.
The report wasn't the full month of shutdown. Sean?
Yeah, can you tell me, has there been any response from the hotels that have not paid their occupancy taxes?
We reported last week at GO committee, based on their advice, we had gone back and looked at the room tax collections, and after Jason and Jonathan and I met, which was the direction that was given, we devised a letter that went out to all the hotels, and we divided them into two batches, those which sent us returns but no money, and those that didn't send us anything at all. So
okay, Rick, we've heard the summary. So I thought the deadline to return that money was June 10th. Is that right?
Yeah.
We gotten any response back yet?
No, I don't know. I don't monitor it myself every day, but we'll report back to you when that period closes, and we'll let you know how many, if any, have sent us more money or none at all.
I think they have till June 10th, right?
June 10th.
Yeah. Okay.
2 days.
All right. Thanks very much.
One more thing, two more things. I'm going to be bringing to the legislature next week the auction report. Last week, Darby and the planning department brought their foreclosure memo to the GO committee, and what they do at that point is that they remove any properties that they want to pull for various reasons, usually conservation reasons or liability concerns. So they made their recommendations at their meeting last week, and I'll be bringing a short capsulated version of how many properties we have on auction, which is scheduled for August 17th, and how many and what action the GO committee took last week.
Okay.
And my final item is, because the audit is going so late and so long, we met with the auditors. We rescheduled most of our deliverable dates, and most of our schedule has been pushed back, some dates as far as 6 weeks. We were going to have the budget committee review and hear the auditor's final compilation of the report in July. That was scheduled for the July 13th budget meeting. That isn't going to happen. We have to push it back to August, and we can't make the regularly scheduled date of the 10th because there's other commitments on that date. So what I'm looking for the budget committee to perhaps do for us, or at least consider, is to have a special budget committee meeting sometime between August 19th and August 25th.
August 19th to 25th. Okay.
Could you consider that and maybe get a consensus amongst yourself? If any of those dates work out, the auditors are struggling, and we're pushing hard to try to even meet that deadline. But we're looking from Wednesday, August 19th to Tuesday, the 25th.
All right. We'll have to go through we'll have to look at other meetings, and I'll do some kind of email exchange. How much time should we plan for it?
About 1 hour.
Okay. I want to move along because we do have an executive session, so we'll get back to you on that.
Thank you. Appreciate it. That's all.
Anything? Okay. Thank you very much, Rick.
You're welcome.
Resources, Lisa Holmes, do you have anything else you've been working on?
Really, very, very little else. I just wanted to give you a really quick update on the we've heard from a number of furloughed employees that they received their unemployment insurance benefits with a fairly quick turnaround time of a couple of weeks. So I thought that was positive information I wanted to share. I've heard that from a number of employees. I've not been hearing from other employees of any problems. So I think that's good. We've probably processed an additional 5 to 6 voluntary furlough requests since the initial wave of 90 some odd furloughs went into effect. So an additional 5 or 6 were approved. And that was a win-win for both them and their departments. And we have had, with the opening of the courts and the DMV and some other programs, some individuals who are being called back from furlough early to address those reopenings. So I just wanted to let you know that's a fluid situation, but we're working with it. It's going well.
All right, really glad to hear that unemployment wasn't too bad for those folks. It's great.
Yeah, same here.
All right. Any questions for Lisa? Thanks very much, Lisa. Dominic on the call? Dominic Recchio? Okay.
No.
Okay. Annie Corman, any report on WDIC?
Sure, just really quick. I'm just still a little discombobulated. My internet went out and my home phone, and I was half on the meeting before earlier and half on trying to call the internet company. So I apologize for that. I did give a report at the last legislative meeting, so there's nothing new from that. The only other thing that I would just had a question on is, and Martha, you keep mentioning, like the telework. And so I'm just wondering if the protocols, I guess this would be for administration, if the protocols that Kit Gebhardt at DSS and that they developed, if any of that protocol has been used for people working at home.
I can speak to that. So yes, when we did the very abrupt change to home telework, we adopted guidelines for telework that was an abbreviated form of that policy that went out to all employees, and we've been operating under that. And now that we are going to be returning back to work, we are developing and will be bringing forth to GO and the full legislature a telework policy for the entire organization that incorporates some of what DSS has done in the past, a lot of what we have learned in this COVID-related teleworking environment. So that will be coming to you shortly for review.
Okay, thank you. And does that include, and I can't remember because I know we've had presentations on it before, but does that include evaluating ergonomics at home? Actually, as I'm saying it, I think that does include evaluating their ergonomics of their setup, right?
Yes. I need to look back exactly. I think we do speak to it.
Okay, thank you.
Mm-hmm.
All right. Any questions for Annie, or I see Leslie on the call for WDIC? All right. Thanks very much for your report, Annie, and hope you get the technology worked out. Can I get a motion on the minutes of May 11th in your packet? Moved by Deborah, seconded by Dave McKenna. Any comments? I gave Kathy a couple of small things. The only thing of any kind of substance was just that the resolution on the lease for workforce development is for Tompkins County Area Development, not the Department of Labor. So she just took in those changes. We have one appointment for the Workforce Diversity and Inclusion Committee. Could I get somebody to Ken Clark to be appointed?
You gotta move the minutes.
Yes.
You gotta pass them.
Thank you. All right, all in favor of the minutes? Can I say Shauna, yes, Deborah?
Yes.
Deborah, yes, Mike Lane,
Yes.
Dave McKenna, yes, and I'm a yes. Thank you all. All right, Ken Clark to WDIC. Can I get a motion there? Moved by Deborah, seconded by, okay, Shauna, Discussion, all in favor, Dave McKenna,
Yes.
Shauna Black,
Yes.
Deborah Dawson,
Yes.
Mike Lane,
Yes.
and I'm a yes, that's unanimous. Thank you all very much. Anything else before we go into executive session, Jason or Lisa, for us? All right, again, thank you so very much for this opus of work that you've put together. And I think it will certainly make things simpler going forward. And I hope we get some people feeling like the early retirement incentive is a good fit. And we'll go from there. Thank you so much. Can I get a motion to go into executive session to discuss personnel issue regarding a particular person? Jason, you can't move that. Yeah,
I'm
Jason.
gonna leave.
I'm sorry.
I'm gonna leave as well, right?
Yes, yes. Thank you. Yes. Kathy, yeah, I do not expect us to come take any action afterwards. And Kathy has the authority to run, to host the meeting without any other staff involved, just so everybody would know that. So, and legislators could stay on the call. I see other non-committee members, legislators can certainly stay on the executive session. All right. So move to executive session. I didn't see a hand. Who was the moved by Mike Lane, seconded by Shauna Black. All in favor, Dave? Dave McKenna, yes. Shauna Black, yes. Deborah Dawson?
Yes.
And Mike Lane?
Yes.
And I'm a yes. So we are in executive session. Thank you very much.
Martha, give me just a minute to shut down, please.
You betcha. Okay.